President Masterson is trying to log back in, so hold tight, everybody.
Do we have Speaker Reichman on here? Not yet. Bill, the question is, did you take that picture or did you find that picture?
I think I found it.
Yeah, that's a good one.
I was kind of looking on my computer trying to find anything other than a hotel room.
Well, you done good.
The speaker said he's trying to join.
You got me now?
We can hear you. Can you hear us?
I got it.
All right. And speak should be on shortly.
I actually think this is the first time I've seen you without a tie. I didn't actually know you had an Adam's apple.
Yeah, pretty big one, actually.
Well, while we're waiting for Speaker Reichman, why don't we dispense with formalities, get the roll called, and hopefully he'll be on here shortly. So I'm calling this meeting of the Spark Task Force to order. Calling the roll, President Masterson.
Here.
Secretary Burns-Wallace.
Here.
Mr. Orman. Here. Mr. Pickert.
Here.
Mr. Rawl.
Here.
Okay, and Mr. Speaker, have you joined us? Well, we have one item on our agenda today, and that is the continuation of our discussion on nurse and frontline care worker support. And I want to express my gratitude to our 3 private sector members who have been burning the midnight oil, I think, the last 48 hours to fashion a proposal that reflects the conversations that the task force has had both Wednesday and last week. And Mr. Rolfe, Mr. Orman, Mr. Pickard, I'm not sure who's running point on giving us the overview of what you have put together. Should that be you, John?
I'm happy to let Greg take it if he'd like it.
Okay.
I'm happy to, John, or you can. But why don't I go ahead and just get us started, and then to the extent that either you or Bill have additions, please obviously interject. But I think what we were trying to do here is obviously come up with a program that meets the goals that were outlined by the Spark Committee, which is to figure out a program that helps hospitals in the state retain frontline care workers and predominantly nurses. We all recognize that they've seen significant increases in the cost, particularly of skilled nursing. We've all heard in detail the concerns related to the alternative of nurses entering the traveling workforce, and ultimately the concern is that leaves us with fewer staffed beds for Kansans during a very obviously difficult healthcare time in our state. And so what we did was took a look and tried to address some of the concerns that were expressed in the last meeting. There are some things that have been left out of here, and I'll also touch on those and why we left them out. But just to run through it, what we determined made sense, and again, these are all subject for discussion and debate, was first that we immediately make available 30 of the $50 million that the State Finance Council has approved for a retention program. The additional 20 million will be made available post Spark review of the implementation reports from recipients, and we'll talk about that in a minute. But the intention behind breaking it into two tranches was, number one, to recognize that we may get into this in a very brief period of time and figure out that there are problems with it, and we want to have the ability to course correct and fix it. Number one. Number two, we've heard from one healthcare provider in particular, Advent Health, who has a hospital that's going to be coming online the first week in October. And I think their concerns are they're excluded from this program the way it's designed, and that might put them at a significant disadvantage as they're looking to help us increase healthcare capacity in Kansas. And so we wanted to have some ability to sort of take a look at this and make sure that, number one, it's working as intended, and number two, that we have the ability to make modifications as necessary, recognizing that we're not going to have a whole lot of additional information, but ultimately, given the reasons I've stated, that it made sense to do that. Qualified facilities would be any general or critical access hospital with an emergency department as defined by statute. Funding allocation would be based on the funding allocation consistent with the proposal made previously, which is effectively to take the number of licensed non-ICU beds divided by 6 and the number of ICU beds divided by 2 to determine effectively we'll call it the facility nursing requirements, or FNR, and then dividing that by the total nursing requirements in the state. So as an example, if an institution had 80 was the number of functional nurses that we assumed they had, and there were 8,000 in the state, they would end up getting 1% of the funding allocation. We also tried to address the issue of what happens if a qualified facility leases beds. And we believe the funding should follow the bed because, again, the goal is staffed beds. And so that provision has been accounted for in here. And we also made the decision that once the funding allocation for a qualified facility is determined, that it made sense for the Kansas Department of Health and the Environment to advance the funding to the qualified facility as opposed to having them seeking periodic reimbursement for the money. To the extent they're not spending money consistent with how the program was designed or not consistent with the compliance requirements of ARPA, obviously it would be subject to recoupment. And we've also allocated 1% of the program dollars to KDHE for administration. In order to use it, they can use it either through the premium pay program as defined in ARPA, or to meet what we've heard from, a reasonable percentage of, and when I say reasonable, probably 20 to 25% of the facilities that we've talked to have suggested they'd like the ability to design their own retention program. So we've sort of left that up to and at the election of the qualified facility to determine whether they want to do the premium pay program or develop something on their own. With a cautionary note for them that if they want to do something on a custom retention program basis, that they really need to have a dialogue with the Office of Recovery to discuss the compliance requirements, because the compliance requirements are greater if it's a custom program versus a pass-through under the premium pay program. We did have a couple of caveats in terms of funding restrictions. Number one, we didn't want to create a program that encouraged qualified facilities to poach employees from other healthcare organizations in the state. So the money can be used to retain existing clinical staff, both nurses and other frontline care employees, rehire retirees who have retired since the pandemic began and aren't working otherwise in a similar capacity at another healthcare institution in Kansas. And then ultimately to hire new nurses or support personnel, frontline care employees who are getting their first full-time nursing job in a Kansas facility. And we put a specific note in here. There was some concern that oftentimes as nurses to be are going through school, they either work part-time in a different capacity in a hospital or ultimately might have a practicum experience that they're engaged in. And those people obviously who are doing it as part of getting their nursing degree or in the run up to getting their nursing degree would obviously be considered a qualified employee as well. Funding is limited, consistent with the statute, to $13 an hour for hours worked from September 1st through February 28th, 2022. So we made it a 6-month program, and the thinking there was we're effectively giving people, giving the qualified facilities the dollars to be able to retain employees through the end of the year if they go to the full $13 an hour. But many might decide to bifurcate that in certain classifications of frontline care employees. They may decide it makes more sense to pay this out as a percentage of income capped at $13 an hour. So if they're making decisions under the premium pay program that would allow them to extend these dollars into 2022, we didn't want to discourage them from that. It must be, if they're in the custom retention program, obviously it must be spent on pay and associated benefits, but it could be spent in a way that doesn't relate to hourly or a direct hourly pay decision. Any funding also, any dollars spent must be spent in a manner that's additive to existing pay and benefits that were in place as of August 31st. We're not looking to make this a retroactive program. We're looking to make this an additive program to really send the message to the frontline care and nurses in Kansas that we value what they're doing and we don't want it to effectively replace compensation that they're already getting. We've put some implementation reporting in. Effectively, what we're looking to do here is figure out how much of the dollars they've spent through October 31st, what they're spending on a weekly basis, and ultimately get some sense as to whether or not this is working to retain employees. So we're looking to determine, as of September 15th, what kind of frontline care employees they have employed and where they're at October 31st. We're trying to get a sense for whether or not we're having the desired effect. And John can talk a little bit in a minute about maybe an alternative here, which is focused on turnover that we've talked about. And then obviously they're going to have to comply with all the requirements of ARPA to make sure that these dollars aren't subject to recoupment from the federal government. One final note that I would make, we talked about whether or not we wanted to have healthcare institutions report their profitability. The intention there was really to get at, is there a genuine need on the part of the healthcare community for these dollars? And initially my thinking was, if you're making more money in 2021 than you were pre-pandemic in 2019, there really isn't a demonstrated need here. And having read ARPA, it's clear that there's an intention, a legislative intent, to make sure that these dollars are going to places where there's a demonstrated need. After talking to a lot of the folks in the healthcare community, I've personally come to a couple of conclusions. Number one, there are institutions in this state, in fact, some of the largest, that really are making more money in 2021 than they were in 2019. So there may not be a demonstrated need there. But if we went ahead and prohibited them from participating in the program, recognizing that what we're doing here is distorting markets, we would be forcing them to either pay their nurses and frontline care employees more money out of their own profits, in effect, in some senses, punishing them for being efficient. And number two, and maybe more importantly, if they elected not to make those premium pay decisions, we would be creating a perverse incentive for their frontline care workers, because they wouldn't be able to go under this program to another qualified facility in Kansas. We would be creating an incentive to push them into the traveling nursing corps or outside of the state if they wanted to get those additional dollars that every other nurse in a qualified facility in Kansas is eligible for. And so, again, while I don't believe there's fully a demonstrated need by all healthcare institutions in Kansas, there clearly is on the part of many. And I don't think we want to create a perverse incentive that discourages nurses from working in Kansas. And so that's why we specifically left out the financial reporting piece and the sort of defined need piece on the part of the qualified facilities. With that, I think I'll stop, and John and Bill, if there are other things you want to add, and apologize for that long explanation.
Go ahead, Bill. Anything you want to add before I go?
Well, I think the proposal is pretty complete on its face. I guess the concern that I've got is if I was a hospital administrator, am I designing a program that's going to be 60% of 50 million? Am I going to design a program at 100% of 50 million? And so the question in my mind is, recognizing we want to make sure that we've done something good here and that it's actually helping to retain staff in Kansas. The concern is how do we, what do they do as hospital administrators, and how quickly are they going to have the second tranche, and what impact is that going to have on their decision making before they get it? Will they reduce the overall size of their incentive program to only be at 60% of the approved amount, or not? And if they get the second tranche, then do they come back with a revised program with more money to the employees? But I think, honestly, I think if I was a hospital administrator, I would be only counting on the 60%, and not assuming that I'd get the other 40%.
And I'll add to that. I think this got better the last 2 days through the work that we did, and I really appreciate Greg putting the pen to paper here, so to speak, based on the conversations that we had and the place that we got. So I feel like it's more complete. It offers more flexibility where it can. To me, where I see the demonstrated need is it's important to the state to have as much hospital capacity for COVID and non-COVID reasons, and that there's a clearly demonstrated need to hold on to our nursing capacity. The only place really of disagreement probably between the three of us is around the two, whether it should be two tranches or one. I'd also be in favor of the 50 million. And Mr. Chair, probably what I'd suggest we do is take questions on the details of this thing, and then maybe Mr. Orman can make a motion for this as stated and sent out, and I can make a substitute motion on the 50 million. We can have a vote on whether we want to do two tranches or one, and then have a vote on the overall project. But I'd love to make sure we can answer the questions and the details, because we certainly got down to a deeper level of detail on this thing than we had 2 days ago.
Thank you, John, Greg, Bill. Tremendous amount of work's been done here, and I agree. We are in a better place than we were 2 days ago, and so thank you for that. Speaker Whiteman, have you joined us?
Yes, I have, and I have been able to listen. I do appreciate all the work that I've been put into this. You three guys did an outstanding job. You addressed a lot of our concerns. Is this a time that I can express and ask some questions or express concerns?
Yeah, please go ahead.
Thank you, Lieutenant Governor. I think again, appreciate most everything in this. The one thing, obviously, you picked up the flexibility piece of it. I like the way, Greg, you explained the clawback and how it probably be counterproductive. I tend to be in favor of the 30 million because one thing that's not in here yet, and maybe you guys talked about it and you couldn't get in there, was the local match portion. So my initial thought when I got this a little bit ago was, if we did the 30 million now and it gave a little more time to flush out, if we can take that other 20 and have a match by 20 from our locals, now we're looking at $70 million out to our hospitals, not just 50. Again, maybe you guys looked at it and didn't find a possible way that can be matched. And I can respect that, because you guys did a lot of work on it and moved the needle on a lot of things. But if you didn't have the opportunity to flush that out, maybe if we just do 30 and hold back to the 20, there's a chance that part of that 20 can be matched to grow to be more than just 50.
Yeah, we, and Greg, I'll let you speak to this too. We didn't spend a whole lot of time on that. The difficulty that we run into on that, Mr. Speaker, and I really like really in every conversation about where we spend money, the idea of whether or not we include a local match, because I think it's important to know whether the communities believe enough in a project, that's coming forward. With this one, because you have people being transferred all over the state when they get acute care, here in Sedgwick County, where, many of our beds are filled with people that don't live in Sedgwick County. It feels a little unfair that the places where the most hospital beds are would be put in a place to carry the load when they're caring for passengers from all or passengers when they're caring for patients from all over the state. And that is just, it was difficult to find what felt like a fair way to accomplish that goal.
I'd just add that, some of these obstacles that we overcome the last two meetings, we didn't think we can get there, but we did. And I understand that Sedgwick County shouldn't carry the whole burden just for the hospitals located inside their county. But maybe there's an opportunity or a discussion that they have with the surrounding counties if they would want to pitch in, knowing that their citizens end up in those facilities. Take Johnson County, for example. Obviously, it wouldn't be just Olathe getting money to Johnson County. Maybe it's the other counties surrounding that serve service into KU Med or the hospitals in Johnson County. Again, not a decision for today. I'm just saying if it was a $30 million now with 20 later, maybe we have some more time to flush it out to see if there's interest in those surrounding counties to participate or cities to participate. And maybe leave it up to the hospitals to make a few phone calls to their partners and see how important it is to their surrounding counties. And if they come back a week or two from now and say there's not interest and that Wichita would have to carry the entire brunt of it and the surrounding counties don't want to participate, then we'd have our answer. But I think we do have time on our hands here, especially if we get the 30 out right away.
So, Mr. Speaker, a couple of thoughts in that regard, and maybe just sort of circling back to this question of one tranche or two. Candidly, I could argue either side of that argument. I see compelling arguments on both sides of it. I hear what Bill is saying in terms of how it might affect the decision making of a hospital administrator. And that's, one of the things that I sort of think we need to emphasize here if we pass this is the intention in doing two tranches is to leave us in a position to make adjustments to the program as necessary, but make it fully clear to the hospital association and the nurses in the hospitals in the state that the full 50 million has been appropriated by the State Finance Council. And so the intention would be that there would be dollars there. The question is would the program be tweaked or modified at all? And I agree, the potential of including some dollars from local agencies of government might be one of the ways that it would be tweaked. I also think that, this pandemic, as we all know, is ever changing. Every time we think we've got it beat or there's a pathway to zero infections, a new variant comes up and ultimately circumstances change. And I think the idea of adding local dollars, one of the benefits of that might be to extend the time frame of the program. So, the local dollars could come in to sort of genuinely fill those gaps between a program that's been sized to take us through the end of the year, even though we've given hospitals the latitude to spend it through the first couple of months of next year. But it might be able to supplement the dollars to the program to extend the life of it if we see that this fourth wave is extending out and we're not getting it under control. So, in my mind, if we went with the two tranche approach, it would also be with the real clear message to the healthcare community that 50 million has been allocated by the State Finance Council, and the question is likely, very likely, not is that additional 20 million coming out, but are there going to be any tweaks and modifications to the program to make it more effective? And again, I mentioned the Advent Health issue is one where, again, we're distorting markets, and we're basically saying to Advent Health, thank you for bringing on new healthcare capacity, but by the way, we're going to put you at a financial disadvantage out of the chute because you didn't get it done fast enough to qualify for this program. So, those are the arguments. And the third thing I would say is part of that is also, in response to President Masterson's early comments, that he'd like to see if this program's working, if we're actually getting and retaining people, so we're retaining staff beds in Kansas. But as I said before, I could argue both sides of this issue, and I'm personally not going to be offended if we go with one tranche or two tranches.
So Lieutenant Governor, you ready for some comments over here? So,
Mr. President, go ahead.
yeah. So, first, I do appreciate the work. I'd like to think I'd be like John if I was the one that worked on it the last 2 days. I think I had a pretty good work product too, right? So, did a great job. But I guess where I am, and I'm not, I do have an ability to read a room, so I think we're trending down a certain path. I can't say I'm not a little I'm comfortable with. I'd actually be more in favor of the 30. I'd like the 2 tranches. I think we're missing some things here. I think some concern, and obviously I'm the one speaking up on some of this context, so I'm the one receiving the scores and scores of these fearful emails. So I'm trying to figure out some way. So I can't say I'm not a little disappointed that we're not even having some modest accommodation to help curb discrimination and coercion, but understand kind of where things are at. I would like to see some of that in the reporting. If this is the angle we're going to take, I would be interested just so I can test the theory to see what's right. I think, I'm going to pick my battles and my wars, right? And obviously the battle I felt we needed to participate in, thanks to some of the dictatorial edicts yesterday, I think the war is going to rage on another front. So in this context, I would like to see some reporting, maybe add a line. I'd like to know, as of right now on September 15th, what are the COVID-related policies of those that are going to receive the money? What are your current COVID-related policies? Are they quarantine? What are your quarantine policies? If you showed up somebody without a mask, was tangentially exposed, am I out for 15 days? And that's what I got other shortage issues. So I'd like to know any related, whether it's the vaccine mandate, are there any declination exceptions like the Mayo Clinic has on that? And because some of these aren't even going to be implemented, right? I think the announcements are, I think it's Stormont Vale that announced they're not even doing anything until October 31st would be at the end of this reporting is what we have here. So we wouldn't even know what that effect would be there. So, but I don't want to delay because we have had, we've had frontline workers. I mean, you can even call them heroes on the front lines for the last year and a half. My only fear is that we're going to get some of them premium pay and we're going to give some others a pink slip. And so that's why I was just trying to have some accommodation for this potential discrimination. But I can tell it's not going to be in here. My other concern is that we've kind of abandoned the language. And, in politics, language is important in implementation, right? We've abandoned the language of a desire to increase our capacity. That doesn't appear to even be a goal. It looks like it's all turned to retention. And so I want to know about what that means in the retention. So I'd like to know what the current policies are. I'd like to know any policies as that goes forward on the October 31st date. I would like to have in that report any frontline worker that's listed here as qualified here that was quit, let go, or retired. I'd like to know that number of people, just because I need to know if what the proposed theory is actually happening. And the goal is that we're about to spend 30 million, 50 million for zero new gains. We're just hoping to save the losses. Lieutenant Governor, you've been in this on the jobs front, right? That's new and retained jobs. Well, you can easily show a new job. Pretty hard to kind of move the numbers around to show I retained X number of jobs and how did my policy affect that? And we see that all the time. So I'm not going to fight at this time. I mean, I'm going to fight. I'm just not going to do it right here, right now. So with that, I'd like to see those two things accommodated in the reporting. And I would also be in favor of the two tranches so we can get a look at it.
Mr. President, would in terms of just reflecting that concern, would it make sense to include in the reporting, to the extent that they had terminations, whether voluntary or involuntary, the purpose behind them, the reason for the termination?
Now, I don't want to get into any HR, anything
Sure.
that's internal, right? I mean, just broad stroke. I don't need to know this is the name and this is what happened to them. I just need, yeah.
Just
I would like to understand
numbers, just numbers. 4 people. 4 people were terminated for cause. 3 people were terminated because of a refusal to get a vaccine. 2 people were.
Yeah, that I would like that broad stroke information because the total number, I could have 20 nurses quit and I found 20 over here. And so I have a net 0 and no new beds. Truth is, I could have had 20 new beds. So that's what I want to know.
Yeah, understood. And I personally don't have any problem with asking for that kind of reporting as well. And the other thing I would suggest, Mr. President, as part of the challenge here, as you know, having a daughter who's a nurse, and my mother was a nurse. I mean, going through nursing school is a commitment. It's not like, adding to, your day labor or staff. It requires you to go through school, et cetera. And I think one of the things that we as a Spark committee probably need to consider in future deliberations is what can we do to help expand the nursing education capacity in Kansas, because I think that's going to be our best way to get new nurses, other than the rehiring program that we put in here. We wanted to make it very clear that rehiring nurses who had retired since the pandemic was an absolute permitted use of the funds here, because I think that's the only real thing we can do in the short term to expand capacity. To a certain extent, maybe we can recruit from facilities across state lines, et cetera. But I think most of the states around us are putting into place similar programs. And so in some senses, this program is defensive in nature as well. But I absolutely agree with you in terms of staffed beds. I just don't think that's a short-term problem that we can resolve, other than the focus on rehiring people who might have retired in the beginning or sometime during the last 18 months.
Yeah, I think, Greg, that goes along to my point. I agree. The long-term, this staffing, we had a staffing issue before the pandemic ever hit. But then that got exacerbated in COVID-1 because of the way things structured there. You literally had the forced retirements and laid off. I had my first cousin is a respiratory therapist, and he was COVID dedicated and got laid off, right? And so I just want to make sure we're not doing things or incentivizing things or allowing things to be incentivized that actually make our short-term problem worse.
Okay. Thank you, Mr. President. Other discussion?
I would postulate, Mr. Chairman, if I may, for a second.
Please.
I think we will have a very difficult time knowing how well this program's working. In some ways, Mr. President, what you're talking about. I mean, if we get these numbers and we're down 10%, who knows that we wouldn't have been down 30%. It's going to be difficult when we're sitting here at the end of October to know how much our program helped it or didn't. I'd argue that we should, on the reporting, whether we do one tranche or two, that we should get monthly reporting on how the program's going. That KDHE can put together for us as they're part of the administration of the program. But I'd look at a turnover number versus an FTE number or FTE of nurses or frontline workers. Maybe you take June, July, August turnover and then compare it to September, October, November, which would have a better idea if there's an increase in the number of people they have leaving. It's a very, as we learned, it's a very strange market out there. I didn't know until yesterday that in intrastate that we have hospitals poaching from other hospitals as travelers, where someone doesn't have to sleep in a bed other than their own. They just travel 45 minutes to work instead of 10. And I know that's happening all over. So it's a wild market, and I think we have to do whatever we can, and we're really asking. It's important to all Kansans that we have as much capacity as we can, and it really is about stopping the bleeding as much as possible and protecting what we have.
So John, would it work for you then if we added to this in terms of the reporting requirements and suggested that we want them to provide turnover data for the 3 months prior to the program, turnover data until, for September and October, and then add, President Masterson's concerns of, to the extent there have been terminations, please provide a reason for the terminations. And that way we get both the turnover data and the termination data.
Yeah, I'd still vote for one tranche of money. So similar to what Bill was saying, I just think we got to let them plan and know what they have and go execute against this. And then I'd like to know how the program's doing through some monthly reporting. But yeah, I would add turnover to that, Greg, to answer your question directly.
I also have a concern that, the $50 million number is out there. Everybody's expecting it. I'm just worried about the implications of going back and saying now it's 30 million and what that does to the morale of the nursing staff. We heard from several administrators that felt like the conversations that the Spark Committee was having was detrimental to the morale of their organizations relative to the value placed on the work that's being done by the nurses in Kansas. And so I just worry if we go from 50 to 30. But I value the need for information, evaluate the program, and I'd like to know at the end of the day whether we did any good or not. But I just worry about the negative implications to the morale of nursing staff throughout Kansas when we pull it back to 30. So
I guess for clarity, I thought 50 million is already allotted. I mean, 50 million is the number, it's the number. The purpose of this kind of midterm evaluation would be whether or not you need to want to make any adjustments in how the Spark Committee saw the implementation of those dollars, the next 20, whatever was the most successful happening in the first 30 that you don't.
I guess the question is what's the definition of adjustments?
While I'm not a private sector member of this committee, in my capacity as Secretary of Commerce, I'm, as you might expect, in regular contact every day with lots of businesses. And what I get more unhappy calls about is when government puts forth a set of rules that then change later on down the line. And I'm concerned that if we don't clearly set forth what the rules of engagement are going to be on this entire 50 million, we're going to wind up with a situation where we can call them tweaks, we can call them minor modifications, but we're changing the game for hospitals at a time when we need them to stay focused on patient care and not jumping through a set of hoops that could be changing in a few weeks. And so that's my primary concern about the two tranche approach. I think we've got a cleaner, streamlined, efficient way to get this money out the door with one $50 million tranche, but also keeping that monthly reporting requirement through KDHE.
Talking about changing the game like the president did yesterday.
I'm not talking about national politics. I'm talking about the great state of Kansas and how we can make sure that we've got a system that's fair and that's achieving the goals of providing patient care during the pandemic.
Well, as I said, I could argue both sides of this. So I'm comfortable with any direction we want to go. I agree with the change to include the turnover and termination reporting. I like the idea of making it monthly as opposed to just on October 31st. That way we can evaluate what's happening, and get some sense as to whether or not we need to do something different, potentially in addition to what we're doing right now. But so ultimately, again, I realize there's a sense of the room, as President Masterson said. So I'm comfortable with that approach as well.
Okay. Would you like to make a motion, Mr. Orman?
I would move that the Spark Committee approve the process as outlined in the materials that were sent to the Spark Committee, with the addition of additional reporting around turnover in the 3-month period prior to the implementation of this. And for clarity, that would be let's say June, July, and August, and then monthly reporting thereafter on turnover and the reasons for terminations. And I will leave it at that. And if John, you want to make your substitute motion, you can.
So I believe we need a second first on that motion. So we have a motion on the floor. Is there a second?
Speaker Reichman, I'll second.
Okay. Thank you, Speaker. A discussion on the motion.
Love to make a substitute motion.
Actually, I'd
I
like
like
to
that.
have included in the
Discussion.
motion I would like the reporting on what the COVID related policies are as well. We kind of brushed over that. That's just where they stand now and where they may stand as the reports go forward.
Okay, Mr. President, Mr. Orman, is that acceptable to you?
Yes, it is.
Mr. Speaker, as the second, that acceptable to you? Speaker Reichman?
Yeah, I was just going to say that that obviously I'm in favor of both these, but I do agree with the two buckets for the reason I stated earlier, that I think that 20 money can grow. If we gave locals an opportunity to participate, I think they would gladly want to help their hospitals, even the ones that are surrounding counties. But if we're wanting to move on, we need clarity. And so I think we have two good choices. I think, I know Greg's motion is superior.
Okay. Thank you, Mr. Speaker. Mr. Rolfe, you wanted to make a substitute motion?
Yeah, I'd change in Mr. Orman's motion, instead of 2 tranches of 30 million and 20 million, one allocation of 50 million at the beginning.
Okay. We have a substitute motion. Is there a second on the sub?
I'll second. This is Secretary Burns Wallace.
Thank you, Secretary. Discussion on the substitute motion.
On discussion, are there extensions in the reporting as well, though, or we would only anticipate a report in October, or does that include your monthly reporting piece that would it go further than that?
It includes Greg's monthly reporting all the way through the end of February.
This is Secretary Burns Wallace. Just one, I just want to make sure, just more for technical, so that we're all on the same page. When we start the monthly reporting, as we're talking about it, I think one of the reasons that you all might have also used October 31st, just given time, once you get this stood up, that being the first, is I just want to make sure that we're all comfortable, like that's the first report in. Just given time, to stand this up and make sure we can get everything in place and stood up. Your first one would come in October 1st, and then it would be monthly reporting from that point forward based on how it's been lined out. Is that correct?
But I think that's fine. What I would suggest, however, is remember the intention also is in that first report, they would include turnover statistics from the June through August period as well.
Yes. So everything that's lined out would stay in place. It's just more so of, I just want to make sure that we're being clear that like that first of anything that gets approved as a part of it would come in that October 31st, because it will be hard pressed to be able to pull that and be able to get some of that by the end of September, and may not be as reflective. And then from there, it could be monthly for any of the additional aspects of it. So
Thank
I
you
just
for
wanted
that.
to make sure we were on the same page.
Thank you, Secretary.
Are we going to receive a kind of a written? I'd like to make sure that the clarity of this motion, right? I know what is the written portion, but will we be trying to figure out? Do I need something a little more specific on this one? Not that I'm cynical.
So just so the level of specificity you're looking for, Mr. President, is it would be beyond what's on the paper.
Yeah, because really everything that's not on the paper is predominantly what I'm interested in.
Mr. President, if it's okay, and if it's okay with the committee, I'd be more than happy to go ahead and quickly redline to include the 2 additional provisions that I intended in that motion. And then I would also point out that the reporting is supposed to go to the Office of Recovery and the Spark Committee. So the Spark Committee will be able to directly receive the reporting as well. But I don't have any problem putting that in writing, and probably can do it in the next 90 seconds.
Well, Mr. Chairman, if he can do it in 90 seconds, I suggest we delay the vote for 90 seconds.
We can certainly do that. Thank you, Mr. Orman. Additional discussion on the substitute motion.
Just for clarity for me, when we vote on this, Mr. Chairman, we're just voting on one tranche or 2, and then we'll have a vote on the original motion based on how
So we will vote on the substitute motion. If the substitute motion passes, then the original motion is dead.
got it. And if it fails, then we go back to the original motion.
Correct.
Thank you. I'd also point out that not only are Greg's motion superior, his typing skills are also superior.
I'd like to know how many words per minute Mr. Orman can type. That's
a risky thing to say from the guy who made the substitute motion, to say that the underlying motion superior to your own.
I'm humble enough to
vote no.
I think Speaker Reichman has a good point about trying to encourage local participation in supporting their local hospitals. And I don't know if there's something we can do as a Spark committee that would encourage them to do that with or without, a specific match requirement. But I think the message should be loud and clear based on the work and all the conversations we've had with the hospital administrators, that those organizations are suffering and that they need the support of not only the state, but their local communities. And they should be encouraged to identify funding and other ways to support their hospitals. So I think that's clear and something that should be encouraged one way or another.
I agree with that. And I think, one of the underlying tenets of all that I hope we do through Spark is that this is about a partnership between state and local communities, and there needs to be skin in the game at all levels. And we want to, particularly in this case, encourage folks to think beyond their county lines and look at the larger picture of where the needs are and what we can all do to help get our state and its people through the pandemic. And so I think the speaker's point is well taken, and I appreciate Mr. Pickert, you're amplifying that.
I appreciate the comments, and I think the way that happens is that we pause on the last 20 to let them have an opportunity to do that. And if it doesn't come back together that way, and local counties aren't willing to participate, then we go back and authorize the final 20. But if we really want participation, there is a carrot here that's basically can be matched to grow that last 20 million, and we can get up to 70 million more for hospitals, or a total of 70, not just 50, or we can get a total of 60, and not, if we want to do 10 and 10 and have 10 be matched. But if we vote for the substitute, the opportunity's left us. There's really no incentive for locals to kick in.
I don't know that there's no incentive, Mr. Speaker, but I do think that, you know, it's likely that there are going to be needs that extend beyond the horizon of this particular proposal. And so what I think we've got is an opportunity to begin having this conversation about what happens in the middle of winter when these dollars go away. How are we going to be able to address that through a partnership with local communities and others? And so I don't know that we've missed our opportunity to have that conversation and to be able to continue solving problems together if this you know, if this substitute motion passes. But I do appreciate your point.
Mr. Speaker, I might add, I don't, if I believe that we could expand this money, I'd be all for the 2 tranches. I don't see a way that we could expand it without withholding some of it, without it being a match. And so, you know, back to the point of changing the rules or changing the game midstream, the only way I think we could secure a match is if you only got the match if it was available. So we'd be withholding part of the 20 to try and entice the match. And so I just don't see a clear path.
Yeah, and I think what I mentioned earlier is that if we have a little bit of more, we have more time, just like this process. Look how it's worked, how we are from a week from now, where we're at today, by taking a little more time to ask. In the next week or two, if the counties don't, if our administrators reach out to the counties and say, do you have desire to help with this? We can get a 2-to-1 match or a 1-to-2 match or however we want to set it up. But the answer is no, then we already have, like the Senate President mentioned, we already have the 20 million there. We can just run and allocate it. But I think I belabored enough. I do think it's a missed opportunity if we vote for this to get extra money for our hospitals and nurses. But I'm excited about the 50 we're about ready to do.
Thank you, Mr. Speaker. Mr. Orman,
I'm
how's it coming?
just saving it. And I'll
Okay.
send it in a minute.
That was at least 120 seconds.
Well, you didn't have to. I didn't have to expect harassment during it, but and I accounted for the harassment. It would have been much quicker. Okay. Okay, I've sent it off. President Masterson, just for your benefit, what I added were under the reporting periods, the numbers 5 through 8 under the reporting requirements. And I also changed the lead-in sentence to the reporting to make it clear that the reporting is due on October 31st and every month thereafter. So that it's clear that this is monthly reporting. And let me know when it comes through. And all I did was replied to all on the email that John sent out a moment ago.
I've got it.
You realize why I could never make a living as a lawyer. Get things done far too fast.
You still charge for the whole hour, even though it was partial.
That's right. Yeah, no 6-minute billing increments here.
All right, I got it.
Okay, has everyone had a chance to quickly review what Mr. Orman has sent? Okay. We have a substitute motion that has been seconded. Is there additional discussion? Okay. Call the vote. President Masterson.
I like how you always go to me first, man. Does that mean I'm the most important guy or the least important guy? How does that work? So I appreciate you guys adding this in here for me. I know, I'm going to pick battles and wars, and I didn't get really what I wanted to have disappointment, but because I really do want to get this money in front of the nurses, I'm going to reluctantly vote yes on this.
Thank you, Speaker Reichman.
I think I'm going to pass to see if two people change their mind, but I will be a yes if they don't.
Okay. Thank you, Secretary Burns Wallace.
Yes.
Mr. Orman,
Yes.
Mr. Pickard,
Yes.
Mr. Rolfe.
Yes.
Going back to Speaker Reichman.
Yes.
Okay. And I vote yes. Motion carries. That is our sole agenda item for the day. I want to thank the entire committee, but particularly Mr. Orman, Mr. Rolfe, Mr. Pickard for their work the last 48 hours to craft this proposal, which is urgently needed and which does reflect a lot of very thoughtful conversation. So thank you to everyone for the work here. Yes, Mr. Rolfe, and then Mr. Pickard.
Go ahead, Bill.
Well, Mr. Chairman, I would like to get some clarification about next steps on getting our advisory panels created. I think it's important we get that process going quickly, and I was wondering the process for identifying those candidates and getting some things put together. Should we each be going out and looking for people in our communities or throughout the state to recommend, or what's the overall thought process about how the Spark Committee is going to come together and develop our committees?
Well, my hope would be that starting next week, we can aggregate names of individuals that would be well suited to serve on the 4 task groups that were approved by the Spark Task Force 2 days ago. And that we can either late next week or the following week make official appointments of those individuals to each group so that the committees, the task groups can get up and running very quickly this month, and we can kick this process into a faster motion than we've been going at. So first of the week, we'll likely send out some direction via email once I've had a chance to visit with President Masterson, Speaker Reichman about process. And so we will be in touch first of the week. And in the meantime, please be thinking of names.
Okay, thank you.
Mr. Rolfe.
I might just say why we have so many members of probably the hospital and nursing community paying attention, that as a group, I think a really important message here, and it got mentioned in the middle of our conversation, but I want to make sure it gets highlighted, is one, we as a Spark Committee and as people in the state are very grateful to the frontline workers and nurses for everything they have done to get us to this point. And we want the message to be loud and clear. We need you in Kansas. As other states are coming to recruit you away, we want you to know we appreciate you. Your neighbors, your cities, and your state need you to stay and help us through this. And we want that message to be out there. It's important. And I think alongside that, what got mentioned is, just continue to invite others into acts of kindness and appreciation for these people who are really out there taking on an extra effort of work day in and day out to be available to us, whether we have COVID or not. I think it'd just be great to see those acts of kindness begin to pop up all over our state for those folks like we saw when this pandemic was first starting. So I just wanted to put those 2 thoughts out there. I know it's reflective of the hearts of all the committee members here, but thought it should be shared.
Thank you, Mr. Rolfe. And I think you're speaking for everybody on the Spark Task Force in expressing that. And, our healthcare workers absolutely are heroes. And I think what today's action shows is that we are 100% behind them, and that there's unity of purpose around making sure that we can get our state and its people through the COVID-19 pandemic. So it's well said. Thank you. Secretary Burns Wallace, were you trying to get in? Okay. Any other business for the good of the order before we adjourn? Okay, could I get a motion to adjourn?
So moved.
A second?
Second.
All in favor, say aye.
Aye.
Any opposed? All right, we stand adjourned. Thank you all very much, and have a good weekend. We will be back in touch next week.
Thank you.